Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to our Mondays Q&As. This is where I answer your specific and direct questions. So if you do have specific or direct questions that is not diagnostic in nature, but can be generalized to everybody else, please feel free to leave it below in the comment section, or you can also email your questions to me at info@drzphd.com. And I will go ahead and include it in Monday's Q&As. Keep in mind that, as always, I make sure that your names are blocked out. That way you maintain your autonomy and your privacy. And as always, I selected six random questions from the Q&A folder for today. So I'm excited to see what today's questions bring to us. As always, there's going to be timestamps down below for you to navigate in case if you want to jump around based on the topics that interest you the most. So having said that, let's jump in and see what these questions have to offer. Question number one. Hi, Dr. Z, or Dr. Z, could you please talk about common excuses to avoid dealing with gender dysphoria or common cognitive dissonance? Yes, this is a great question, because this falls into common, I would say, instead of excuses, I would substitute this with common ways we tend to sabotage ourselves, common ways of avoiding, common ways of engaging in all sorts of other activities other than confronting that which you need to confront. And this is so common for all of us, whether you're somebody who's struggling with gender dysphoria, or whether you're somebody that is struggling with other things you need to do, other projects you need to undertake, but yet you don't seem to get yourself there. Or maybe it's not even projects, maybe it's something else in your life. When it comes to specifically gender dysphoria, let's zone it down a little bit more so it's more specific for all of you. Avoiding dealing with it is going to be even more common. And the reason why it's going to be more common avoiding dealing with gender dysphoria, and when I say dealing, I mean either acknowledging to yourself that you do have gender dysphoria, or going to see a professional provider to confirm you do have gender dysphoria. 3, to come out to people around you. 4, decide what, if anything, you would like to do about it. Because as you can see, there's all these multi-steps involved. Just thinking about those steps is bound to bring you anxiety. I have yet to see a transgender adult that thinking about those steps, coming out, what will I do about my gender dysphoria, how will I accept it, felt excited and happy and couldn't wait to engage with those steps. No. What I often see are individuals who are ridden with anxiety because you're all adults. You're not children. You know what life is. You have lived up to this point. A lot of you are older. A lot of you have a whole life structured. And you do understand, you have capacity to comprehend how all of those steps are going to have an effect one way or another on the whole dimension of your life, including yourself. So for that reason, just for that reason alone, it's going to be completely natural for your ego to engage in defense mechanisms in order to avoid dealing with gender dysphoria. And some of the most common ones are throwing yourself into work and overworking yourself until you're just really exhausted. And when you do that, what you're essentially telling yourself is, I can't possibly be struggling with gender dysphoria, or I can't even right now allow myself to think about gender dysphoria because I have all of this work to do. So in other words, you elevate the importance of your work, even though it may not be as important as taking care of your health, so that you can justify it in your mind space that the work is way more important than your health. So overworking is a very common one. Another common excuse to avoid dealing with gender dysphoria that I see is continue to engage in a headspace narrative inside of your head, where you constantly justify things within your head, where you constantly tell yourself that this is probably not gender dysphoria. Maybe if I just engage in stereotypical masculine and feminine activities, this will go away. That's another very common excuse. Another very common excuse is to, and I'm thinking about this excuse in a scope of a relationship. Sometimes when people are in a relationship and they're so afraid to confront it because they know it's going to affect their relationship and their lives, One of the other really common excuses that people have is they're starting to think that perhaps if they do A, B, C, or D, this is going to go away. And A, B, C, D, maybe a multitude of things. Maybe if me and my partner go on vacation, maybe if I just go ahead and drastically change something about my life, maybe it's because of this. I mean, I've seen people come up with so many fascinating excuses, including saying that they were cursed, including saying that they feel like this is their middle age crisis. This is a sign when you see yourself constantly bargaining. Bargaining is another one, where you see yourself constantly engaging in a dialogue of bargaining. If I do this, this will go away. If I do this, this will go away. There's always an outcome. If, then, and then is always dysphoria is going to go away. You have to realize at some point that there's only so much bargaining you can do. You have to also acknowledge that you've done so much bargaining up to this point, and yet you still have these feelings and they're not going away. So, it's going to be very common. When you mention cognitive dissonance, what comes to mind in terms of my experience with people and cognitive dissonance is that people will throw themselves into stereotypically strong activities based on their gender assigned at birth. If they're assigned male at birth, it'll be joining some kind of sports or joining an army, for example. And a lot of times they will have this cognitive dissonance in their headspace because they will say, how can I possibly be feminine, or how can I possibly be a trans woman in terms of my authenticity? Look, I have years and years that I spent in the army. I have years and years where, or maybe my life revolves around being a physical trainer. It's impossible. There's no way. It's so anti. In other words, it's so opposite of really how I conceptualize myself. So these are just some of the most common excuses. But you know what? We all have multitude of excuses. Comment below, share with this person your excuses that you engaged with. My recommendation is, if you're asking what are the most common excuses, I would encourage for you to ask yourself, are you asking me what are the most common excuses because you want to see if you're engaging in those excuses, or are you asking what are the most common excuses because you're already recognizing some in you and you want to see if I'm going to confirm them for you? Regardless, we all have to confront things in ourselves. And for a lot of you, for all of you watching my channel, it's going to be confrontation with your authenticity in relationship to your gender. I would encourage all of you watching this, not there yet, it's so much better for your psychological well-being to acknowledge and accept the reality in front of you, that you are having dysphoria, than engaging in a lot of things in order to avoid confronting it. Confrontation, just acknowledging this is reality, it doesn't have to even lead to anything, it doesn't have to lead to transition, it doesn't have to lead to coming out, but just really acknowledging with it is going to really ease a lot of things, because it takes tremendous amount of psychological strength to engage in repetitive, ongoing bargaining and excuse making and sabotaging in order to not feel it. But eventually, what you resist persists. Remember that. So that's what I gotta say. Great question. Very, very common. I honestly, I can sit down today and write a book just on common excuses and just fill up pages and pages and pages with that. This is how incredibly common it is. Because as human beings, we don't like change. We boast and talk about how much we love change because we know cognitively change is good for us. But in reality, none of us like changes, because that means we have to disrupt status quo and we have to push ourselves. So really good question. Question number 2. I'm not the only one involved with a cis woman for 40 years. I think you mean you're married. You've been married, you've been living with a cis woman for 40 years. She was totally negative when I revealed I was going to transition. I chose to slow down and make sure she realized I could never be as womanly as her. Growing breasts never bothered her, but she has large breasts, much bigger than mine. Mastectomies are traumatic, but breasts grow very slowly. Mastectomies are traumatic, but I'm not sure what you mean by mastectomies, because this is like you're talking about removal of chest and then you're talking about breast growth. I can hardly believe after a decade she's all in on my upcoming SRS. That sex reassignment surgery, all terminology, if none of you familiar with that, although I think all of you familiar with that word. They have offered FFS, facial feminization surgery, of which I likely can't afford. That was not taken well at all. She fears I will look better than her. Okay, so you are in a relationship with a cis woman, and sounds like she's feeling discomfort and fears that if you get FFS and maybe other feminizing procedures, I'm assuming feminizing, we're talking about feminizing procedures here, you're going to look better than her. So some jealousy, perhaps. To me, that is ridiculous. I can never equal a cis woman. Never mind, she's way up on the curve of beauty, to the point I have always wondered why, accept me, she could get any man. What I'm trying to say is women are competitive. Hell, yes, they are. You would think we should all elevate and support each other. Mm, Women are, yeah, enough about that. With other women's looks, and not to forget that will include transgender women. Yes, I was thinking about different type of competition, but yeah, women are also very competitive about other looks. And if you get a compliment from women, that's beautiful. If you get the compliment from older women, that's even more beautiful because it lives their lives, they know. This is a new Dr. Z. I have assured she's still super cute and no surgery can equal that. Do you have any suggestions how I can ease her mind? Okay, so great question. So this is a question for anybody that is in a relationship with a partner. Their partner is a cis female. They're going through feminizing transition and they're starting to see that their partner is feeling jealousy or feeling resistance toward your feminizing efforts, and perhaps even vocalizing that they fear you're going to be more attractive than they are. Is there any way to ease your partner's mind? Truth be told, there's nothing you can do to ease somebody's mind when they have a chip on their shoulder in the form of feeling lesser than another woman. In this case, lesser than you, their partner. And that's a hard chip to carry because that's their work, that's their task. They have to do this for themselves. There's nothing you can do to eliminate this chip. This chip may arise out of sense of insecurity. This chip might arise out of so many things, so many internal things, who knows. But if they feel that way in a relationship to you, they probably feel like that in relationship to other women that they see as more attractive than they are when they come across them. And that's a painful competitive space to be in. I just really honestly, I don't think there's anything you can do. Even if I was working with you, I would say I would really recommend for you to encourage your partner to engage in individual therapy, to explore the chip on her shoulder, to work through the chip on her shoulder, because really it's so beautiful to realize your own value, to realize your own beauty, to realize your own self-worth, and to hold on to it, and to realize that you are your own individual self, and everybody is different, and beauty is so subjective too, right? But to constantly carry this chip where you feel lesser than and you're comparing yourself to other women, that's a tough one. But there's nothing you can do. I understand that you yourself feel this is really silly. You feel that she's way more beautiful. Sounds like you yourself don't have that competitive mindset to begin with, which is great and beautiful. Yep, nothing you can do. Somebody comment below, share if you were in the same position with your partner. But we all have complexes. We all have triggers. This is her complex, and if they're not haven't been worked through, that's for us to figure them out. And when I this is completely different comparison. Obviously, every time I compare things from my life, by the way, it's not to mean that I exactly understand what all of you are going through, because obviously I do not. When I was going through after the cancer, I have a tortuously long and messed up scar on my leg, as if I don't know if I had an intern slicing my leg open or whatnot, but it looks like chainsaw went through my leg. And I also have a complete prosthesis, and as a result, I can't really, my ankle doesn't extend as far. I can never wear heels, not that it really matters. But when I was young and when that happened to me, I was 18, and I have two sisters. I have a sister that is 2 years older than me, and sisters that is 2 years younger than me. And honestly, I was very jealous when we would all dress up and they could wear beautiful shoes with their outfits, and I had to wear some really comfortable orthopedic shoes, and it really brought up a whole bunch of insecurities in me. At the same time, even at that young age, I was able to realize that my jealousy was my shit. It was my own insecurities triggering me. My envy toward my sisters was not a mean envy. It was more, gosh, I really wish I could do what you guys are doing. And I realized this was something for me to work through. This is what I really wish she could get to that place where she could look at you and she can say, God, I'm jealous. You're looking really good, huh? At the same time, I'm realizing that the jealousy, it means I have to work on my own self-worth and my own stuff. And it's not personal, it's my own shit, but damn, I'm feeling it. That would be a great place if she could get to that place. Just acknowledging that would be really good. But to prevent you and hold you back from getting feminizing procedures, I think that's not right. And if she has a chip, that's for her to work through. So if possible, I think she can really benefit from individual therapy to work through that complex. But really good question, and it's common. I see this in relationship all the time happening, and that's what relationships are for. People, we bring out certain complexes in other people, and they're just golden crumbs for us to realize we have some gross work to do. Great question. Question number 3. Hello, Dr. Z. I absolutely love all of your content, and you have extremely helped me in my transition as a trans woman, 4 months now on hormones. Oh, this is beautiful. This is like music to my ears, because I truly, everything that I create on the channel has so much heart in it to help all of you. I have a question, and I want to preface this by saying I'm coming from an absolute place of love and acceptance, and I am older, almost 50. Okay, so you're setting the table here. Your question must be a little bit controversial, maybe. A generation which I know you understand is different. Yes, older people, completely different generation. I'm struggling to understand the pronouns they, them, and I've also seen it. I know my old timely mind is probably constrained by gender constructs. I'm collegiately, sorry, people, it's very small font. I'm collegiately educated, and pronouns of he, him, and she, her are obviously easier for me to wrap my head around. However, I'm genuinely struggling with understanding they, them, and it as pronouns. Again, I mean this from the most loving and accepting place. I just truly do not understand what those terms means and why someone would identify as a plurality, they, them, or an object, it, rather than a gender. You worded it beautifully, by the way. And this is, if anybody is confused about anything, being trans yourself, this is a beautiful way to word it, because yeah, I get it. I have a lot of clients I work with who don't get it either. And I think this is very common in older population that not only grew up during different times, but contextually have been affected socially differently in terms of understanding gender and gender constructs. So let me dive into your question. Not understanding why would somebody want to be called by plural they, them, right? And by an object, it. So unfortunately, we live in a world where we have to navigate language in order to either define experiences we're having, find qualifiers and signifiers to identify this, or if we don't find them in a language, we have to use the best we have with means of language in order to at least indicate a departure from the binaries that doesn't suit us. And I'm talking about in regards to individuals who do use they, them, or it pronouns. Oftentimes, this would be non-binary identities. Although I've seen trans individuals as well utilizing these pronouns. They, them, are they ideal in language because they imply plural? No, they're not ideal. But to a lot of non-binary people I work with, it is a better alternative than he, him, or she, her pronouns, something that they already don't identify. Because the non-binary identity is it's not necessarily a little bit of female, a little bit of male. It's what it initially means is I'm not exclusively one or the another. So the non-exclusive is really important here. And I think when people start dabbling into the world of pronouns, instead of coming up with a new language to define a new pronouns, I think there's also the probably pronouncing it wrong, pronoun, which I think is probably better than they, them, because they, them is so plural. But the way I see it is people are struggling to use language to define their experiences. And sometimes when we go in one direction, it may not always make sense to somebody else. The same with it. It is, as a psychologist, I would personally prefer people to use they, them than it, only because psychologically it implies, like you said, an object. It also implies a sense of depersonalization, where you're really personalizing yourself out of it, where you're no longer a person, but you're you're the object. And I think psychologically, that's, I would venture to say, not the best way to go for your psyche. But I also understand, because a lot of individuals who have lived their life not seeing themselves represented in language, and not seeing themselves represented in terms of their gender identity, have eventually got to the point where they are depersonalized from their sense of self. This is, by the way, people don't understand furries, individuals who identify with furries, with particular furry animal, dress up as furries. People don't really get it, but from a psychological standpoint, it makes complete sense why a lot of transgender and non-binary folks gravitate toward that. Because if you spend majority of your life being seen by culture, not exactly as a person, at least not exactly as the person you see yourself on the inside, you are going to go through depersonalization. Oh my God, what a hard word to pronounce. This is where the it comes in. So I understand why people choose it as a pronoun, a preferred pronoun. Again, I don't think it's the best option, but this is just me, to each its own. And when I see people struggling, saying they don't understand pronouns, I encourage to acknowledge that it's okay that you don't understand pronouns. And instead of trying to grasp and look for understanding and meaning and search you have space for it, just allow it to go. Just say, okay, I don't understand now, and see, perhaps understanding will come with time. A lot of times we don't understand because, like you said, perhaps you are affected by the constructs you grew up in. And yes, it definitely plays a role. Also, your experience will play a role. Your understanding, like you said, you have you have some educational background. And so you have also understanding of language and linguistics, and that's also going to play a role. Sometimes we need to acknowledge that what we don't understand doesn't necessarily mean that it's not valid, and it doesn't mean that it's not real, and it doesn't mean that it's deeply meaningful to another human being. This is where the whole war on pronouns that really gets me, when people say, we refuse to call you by your pronouns, don't you impose pronouns? Well, nobody's imposing pronouns, really, and I don't think imposing pronouns is a good thing. I do think, however, that if you misgender somebody, or somebody gets misgendered, and that person says, hey, my pronouns are actually the A, B, C, D, I do think that as human beings, that's where mindfulness, respect, dignity, human kindness comes into play, whether you agree or disagree, because there's lots of things I experience in life where people share with me and I don't understand them. And I have to stop and tell myself, you won't understand everything, because you walk in their life through your shoes and your self-centered experiences, and they're walking their lives through their shoes and through their self-centered experiences. And just because you don't understand doesn't mean that this is not happening over here, and doesn't mean that that's not very deeply valid to them. So just sit with it. It's okay that you don't understand, but yeah, I think that are very common pronouns, and I think they're, in part, they, them, I think are incredibly necessary, because if we don't have they, them, then we just have the binary pronouns, and perhaps until we come with a better language to encompass and to be able to lend some kind of anchoring to non-binary experience, we're going to have this in lieu of that? Great question. Question number 4. Hi, Dr. Z, love your channel. It's been a helpful reference point, and serendipitously, the content that you cover often shows up at times when I need to hear. So thank you for what you do. You are so, so welcome. I'm in my 30s, male to female, began social transition about 2 years ago, and have been on hormones for about a year with surgeries lined up. 2 years ago. Okay, so I'm just sorry, I read it so fast now. I'm trying to have it situated in my head. Not by my own choice, but I was one of the trailblazers at my work who started pointing out a lack of trans-inclusive policies in a lot of domains. Access to facilities, name changes in public facility, facing identity, healthcare, basic non-discriminatory language. Good for you. That's fantastic. These things have caused me a lot of stress on top of trying to perform my job. Advocacy is not for everybody. I always tell this to people. You have to really know it's for you. And it's okay not to be in active advocacy. There's different way to be an advocate. I don't do active advocacy, but I consider this channel to be a form of my own advocacy work. So I have to find what works best for you, but it can be exhausting. Stress up to trying to perform my job, navigate the healthcare system, and generally be present with the experience I'm having. Yeah, I'm curious if, especially for those who are questioning and thinking about transitioning in the workplace, if you could discuss what a safer work environment culture looks like. I know HRC has some guidelines on creating trans-inclusive work environments, but was pretty surprised by policy gaps that exist for us in the workplace, yeah, and how damaging and uncomfortable it can be just to exist and do your job. Great question. And again, first and foremost, I just want to tell you that it's okay to step back from the advocacy you're doing at work, because it's not for everybody, and it does take some mental strain on you because it is constant push and pull with a lot of bureaucratic laws and regulations. So be mindful of that. How can you tell that your work environment is safe? What a safe work environment, in other words, looks like. I'm trying to think, because it's going to also vary. My answer is going to vary on what kind of safety and sense of security you need in a work environment. For some people, safe will mean something else. In generally speaking, I would say, in the very least, if a person walks into a work environment, in the very least, if they see a gender-neutral bathroom, I think that gives a person immediately some sense of relief, because immediately they sense that, okay, already somebody here at this work environment has thought about gender, has at least thought about the binaries of gender. So I think that having gender neutral bathrooms is just really, really imperative, and it's so easy to do, and it's so easy to make them gender neutral bathrooms. The place where I used to rent my office before I gave up my office, they had 2 bathrooms on the ground floor. Both are single bathrooms where you walk in and you lock the door, and one was marked male, one was marked for females. And when I took the place, I said, hey, can I change the signs? I'll pay for my husband will put it up. I'll pay for it. Can I make them unisex? And landlord had 0 issues with it. And I just modified both bathrooms, became just, gender neutral bathrooms. We put a sign that was gender neutral signs that any gender can go into those bathrooms. It's not that difficult, and it's really something that's so easy for employees to implement, really. So first sign of safety and environment is, are the bathrooms gender neutral, or is there at least an option, a more encompassing option? So that's going to be number 1. Number 2, to know that the work environment is safe, is to look at their policies. What are their policies in terms of inclusivity, in terms of diversity? If the work offers trainings where they come in and train, or conferences for employees, do they ever include diversity and inclusion training? Do those things ever come up? what is the health insurance coverage for trans care? You will know that the companies who care about the inclusion for trans individuals will have great policies. Look at, oh my God, I know this because I have individuals who work for companies where their coverage is phenomenal, and their coverage covers my entire fee where they don't have to pay anything out of pocket. I've seen people with great insurances from Twitter, although I don't know if that's still true since Elon took over, but before Elon Musk took over, great coverage from Apple, great coverage from Amazon, great coverage from Starbucks. Now, I know I'm throwing some big names out there, but there's also smaller companies that I've seen have amazing coverage, and you can always tell if they cover mental health services. You already know that the employer cares about your well-being, and then if they have inclusive transgender coverage for medical expenses, for surgical expenses, you also know that somebody in HR thought about it, or at least you know that there's somebody in the company that is trans themselves that went to HR and said, hey, we need to have this included in our healthcare coverage. That's another way you know. If you can't see any of the things, I think that another way is to approach HR and ask HR in confidentiality, where does the company stands on its stance in terms of gender inclusion in the workplace. But that's how you should know. I think that in general, you get a feel of the work environment. Work environments are their own organisms, right? And in my experience, there's often an energetic feel you get. Does this feels like people can talk about things? Does this feel like people are comfortable working here? You can usually look at the employees and see whether there's diversity present. You can usually look around and see whether people are comfortable, maybe even if their clothing and attire is comfortable, or if it's stern and strict. All of those things give you a little bit micro clues where you at, and your body will be able to pick up. You'll be able to pick up if it's safe or not. So yeah, I wish you all the best at your work and with your transition plans. You sounds like you have a lot lined up, so take care of yourself. Make sure you definitely put yourself first, and all else second. Yourself first with all of the things lined up. Great question. Question number 5. Number 5. Hey, Dr. Z, good evening. I have been watching every video and TikTok you posted, which has been helping so much. So glad to hear. I have a question regarding social dysphoria. Is social dysphoria dominated gender dysphoria a good reason to transition? Okay. So this is basically, to clarify for everybody, what they mean social dysphoria dominated gender dysphoria, meaning they, and I will read the rest of the question, but to me, it tells me they perhaps don't have physical dysphoria or not as much. And primarily they have social dysphoria, and they're questioning whether they should transition as a result of it. I don't hate my body. Yeah, I don't hate my body, but I'm dysphoric about what it means for me to be perceived by society. In fact, I want to be treated as a woman and be seen as a woman. And I would prefer to be a woman with long hair, soft skin, and breasts. And if there's a button, I will press it immediately. When I was in puberty, it made me so dysphoric to grow facial hair and muscle mass. But after decades of making peace with my body, it starts to feel okay. So now my appearance doesn't give me too much dysphoria. When I'm being treated as a guy by everyone, I felt strong unease. If social dysphoria is a good reason to transition, does it mean I'm trying so hard to please society? I'm sorry, but obviously also anxiety is present too. But it really doesn't feel like that. It feels like I'm doing this for myself in treating my social dysphoria. So yeah, I'm conflicted. So multiple things come to mind as I read this. First, in my opinion, physical dysphoria doesn't have to be a necessary precursor in order for a person to go through transition. And people have gone through transition without the physical dysphoria as a precursor. Having said that, I also think that if it's like double split, right? It's not a precursor, sure. At the same time, we're talking about surgeries of a large magnitude. We're not talking about some minor modification. We're talking about major bodily modifications. And if you genuinely feel, like you say, you don't hate your body, which also doesn't tell me what does it then mean, because a lot of people conflict with the old inaccurate narrative. I hate my body. I hate my genitals. I want my breasts, I want my penis, I want my et cetera, cut off, removed. That's a narrative that a lot of people had to verbalize in order just to get access to care back when. They had to plead their reality to such drastic extent. We're not there today. So I want to be careful here to acknowledge that people, a lot of times I notice, do have physical dysphoria. They don't realize they have physical dysphoria because they're looking for that I hate, I cannot stand, I cannot look at myself type of relationship to physical dysphoria. So having said that, my first question for you would be, okay, you don't hate your body, then how do you feel about your body? How do you feel about it? Do you feel neutral? Do you feel disconnected? Do you feel like you don't care about your body? Or do you feel like you really like your body as is? So really sit with how do you feel about it? And especially things you want to change your body, how do you feel about it now? And how you feel about considering changing them. A lot of times when I start working with people, they realize, and this may or may not be your case, they realize that they don't hate their body, but they're also, they're okay with their body, but they're also not comfortable fully with their body. And that in of itself is also an incongruency stemming from dysphoria, but that's something subject to figure out. So explore that. That's my first feedback to you. My second feedback is that it is challenging. I don't know what your age is. I am witnessing in my practice more and more and more young adults, 18 to about 25 up to 28, who don't have history of gender dysphoria from childhood. Again, not that you need to have history, but this is the pattern I see, but who suddenly realize they're feeling incongruency, and it stems first and foremost from social dysphoria. When I see things stemming solely first and foremost from social dysphoria, one, it's important to acknowledge that oftentimes the physical is inevitably going to follow because you live in a world that genders your body and genders body functions. So even though you feel neutral or okay about your body, when you go out in the world sees you as your body, and as a result, the world is going to correspond to you based on the bodies they see, and that is going to breed even more anxiety and dysphoria, and eventually you may start associating it with not liking your body as well. So it's important for people who really young and suddenly feel like they have dysphoria, and it is social, not physical for them, to first really explore. This is just my opinion. Again, people may agree and disagree, and that's valid. But this is what I found helpful for these individuals in my work with young adults, to explore understanding between gender identity, gender exploration, and gender role. And I have a video on that, because a lot of times I find that with young adults that I worked with, not all of them, but some, struggle to understand the difference between all those three, and they presume that they all have to be in alignment with each other. So they presume their expression, how they show up in the world, has to be in alignment with their gender identity, and then it becomes a conflict. So that's the first thing to navigate, to explore. So for that reason, I recommend social exploration and diving even deeper into yourself. And finally, the third thing is when I see somebody who says, I'm so conflicted, when I see somebody who says, I'm wondering if, am I doing this for society or am I doing this for myself? To me, this is an indication to spend a little bit more time exploring that. Again, this is not to say that all of the things are an indication that you're going to make wrong decision or it's not for you. But it does warrant sitting down and exploring it. I also think that for individuals who are deciding to go through surgical transition while feeling comfortable with their body, but they do it because they have social dysphoria, I also think while it's their choice, and this is not for me to decide right or wrong, I do, however, think that it is important to also acknowledge that because you're not having that strong physical incongruency that some people feel, where it becomes very clear for them that surgery will alleviate that incongruency, it's important to also acknowledge that it may play out differently. It may play out that it was the best thing you did for you. It may play out that you evolved beyond that. It can play out in so many different ways, and you have to be okay with that. A lot of surgical affirming care services fall, in my opinion, in the category of being able to realize that things may change for a lot of people down the road because identities are not static. For a lot of people, they're not. And to also be okay with that. And as long as you go into that with all of that acknowledgement, I think it's important. So I don't have a straight answer for you because I don't work with you, so lots of absent from the context, but I think I gave you enough to just kind of sit on and think about and think through, and it just kind of navigates those waters for yourself. So I know that a lot of people watching this that have a physical dysphoria or strong, severe physical dysphoria, a lot of you who are watching this and hear this, it may be very difficult for you to comprehend because you're thinking, why would you want to go through surgery if you physically feel fine? And people usually say that they engage in gender affirming care or surgeries because of euphoria versus dysphoria. I don't know. I haven't really formulated what I think about it, to be fully honest with all of you. It's a different topic. It stems into different, because dysphoria is a distress. Euphoria is not really distress. It's a good feeling. So then are we questioning now cosmetic choices and options, and should they be available as such, or medical necessity? So anyways, I haven't really given it much time to think about, but for the person who asked this question, I think you have enough to think about as I offered that to you. Good question, and I really hope you'll figure this out for yourself. And final question for today, question number 6. I got a question for the next YouTube Q&A. I'm an ABAB assigned. Okay. Well, as far as I know, in language, you have assigned male or assigned female at birth. So let's find out. I think it's a typo on your end. And what identify by default. Okay, so you identify by default by your gender assigned at birth, but I also, another part of my gender identifies as female. Okay, so I'm assuming you meant to write assigned male at birth. I just recently realized that it's a few months ago, and I'm not sure what step next to take to deal with this. Also, I live with who would not like that I am this way. Okay, so you live with somebody who would probably not be accepting or supportive. You just realized your identity is female. Your default is your gender assigned at birth, which I'm again assuming is male. What is the next step to deal with it? I would say next step to deal with this would be, if you can, to engage in therapy with a local therapist to explore this further and to find out what, if anything, this all means to you, and how much does all of this has to do with gender, with stemming from the root cause of gender identity conflict, and what can you do to resolve it. That's what I would really recommend. If you're living with somebody who would not like this, a lot of you know this comes not surprise to you at all, and some of you may not like hearing this, but this is where I stand on this. Agree to disagree. I respect that. If you are in a relationship, married, partnership, in other words, you're living with a partner in a committed relationship, and you realize that you have gender dysphoria, in my opinion, you do have to tell your partner. You may not have to tell other people around you. That is your prerogative, but your partner, I feel like you do have to tell them, because you two made commitment, and the reality is that people make commitment based on the gender presentation in addition to other factors. And if you do know you have gender dysphoria and struggling with gender identity and you're not telling them, to me, it is kind of akin to a betrayal. Again, agree to disagree. Um, this is how I really do feel about that. And I know this is incredibly difficult position to be in, scary and terrifying position to be in, but your partner deserves to know. So if you're living with somebody who's your partner, I would encourage for you to be open and transparent and honest. And yes, it's going to be scary. And yes, it may turn out good or may turn out not so good for you, but this is truth and this is reality. But if you're living with somebody else, and I don't know who, maybe you're, I'm assuming you're adult because my channel is for adults. Maybe you're living with your parents or your parents living with you. Maybe you're living with your roommates or somebody else. Then you don't really have to come out unless you figured it out and you want to and you feel ready to. But in the beginning, I suggest engaging in therapy with a local therapist to really explore and dive deep what all of this means for you. So that's what I would recommend. Great questions for today. Thank you very much. Hopefully it gave some of you clarity and answers. If you do have questions for me, comment below, leave them in the comment section below, or you can email them to me privately at info@drzphd.com, and I will go ahead and include it in Q&A. As always, comment below, share what your thoughts are, share your input on the questions. Again, remember, we have a community here and everybody's sharing experiences. I don't know it all. And your input is an absolutely invaluable on this channel. So do chime in and share below, and I will see you all next time. Bye.